Hi, I'm Dr. Shalini, Senior Consultant Gynecologist and Infertility Specialist at Ishwarya Fertility Center, Bangalore. So today I'll be briefing about how to approach an infertile couple. So what is infertility? So the couple trying for pregnancy for past 1 year but having no success, or 6 months in case of female who is more than 35 years. So there are two types of infertility. One is primary, the incidence would be 40%, who has not conceived till date. The second is secondary infertility, which is approximately 60%. The females who have conceived in past, or rather delivered in past and trying for the second pregnancy, or had abortions for any reason. So male factor, female factor, combined male-female factors are responsible for the infertility. There is a category known as unexplained infertility, where there is no reason at all, either in male or female. So how do we approach? So we approach male and female separately. So how do we approach in a male? For the male, first we take the history. So there has to be detailed history about any kind of hypertension, any diabetes, any past history of tuberculosis, or any genital trauma in the private parts which has led to formation of any clots. Does the male smoke or drink or any kind of antipsychotic drugs, or whether he is able to perform well during the sexual activity. The second would be the physical examination of the private parts. Third, the basic test is semen test, the semen analysis as per the WHO advisory. So the male is asked to give the sample or collect the sample after 3 to 5 days of abstinence, and the male parameters are checked. So one would be microscopic, where the color, amount, quantity, the pH and the liquefaction time is seen, and the second would be the microscopic parameters, which could be the count, numbers and the good quality sperms. So depending upon the variation in the parameters, it has different nomenclatures. Like if the count is less, it is oligospermia. If the motility is less, it is asthenospermia. The good quality sperm is less, it is teratozospermia. And there could be combination of above parameters also. And there is a separate condition, where there is no sperms in the male ejaculates. So these male need further evaluation, like hormonal test. So hormonal test helps us to decide whether the male has an obstructive azoospermia or it is the non-obstructive azoospermia, and accordingly the male partners can be treated. Coming to the female parameters, so there could be uterine factors like adenomyosis, fibroid, any kind of adhesion, and the silent killer, which is a genital tuberculosis, where female doesn't have any factors. So in case of uterine factor like fibroid, all the fibroids troublesome? No. So the fibroid which is more than 4 cm, or the fibroid which is near to the uterine cavity, or the fibroid which is hanging in the uterine cavity are troublesome. So a basic ultrasound scan let us know about the various uterine factors. Second, the most important is the tubal factors. So there could be a tubal blockage, there could be collection of fluid in the tube, which is known as hydrosalpinx, or the tubes could be adherent to the uterus and the other various pelvic organs. Tube is a channel through which sperm and egg fertilize. So how do we investigate the patency of the tube? So it could be the basic SSG, or it could be the HSG. So in hysterosalpingography HSG, dye is put inside the female genital part and the X-ray is taken. HSG is superior to SSG because it helps us to know about the site and the site of the blockage. But the last but not the least, the definitive would be laparoscopy. Third is coming to the ovarian factors. So in ovaries there could be hormonal imbalance like PCOD, where there are so many water bubbles. The second, it could be low ovarian reserve, where the follicles are very less. So this could be seen in elderly female or the female who is young enough, known as premature ovarian failure. There could be endometrioma or chocolate cyst, which further decreases the reserve of the female ovaries. Fourth could be the condition known as ovarian cyst, which prevents the formation of mature oocytes. So these are the conditions can be found out by the ultrasound basic TVS scan, which helps us to know about the antral follicle count, actual ovarian reserve, which is seen in the females. So if we evaluate the male and female factors separately in a proper way, we get to know the exact cause, the infertility, and then we can approach in a correct way. So approaching the couple in a correct way helps us to come to the conclusion, and the time to pregnancy for the couple is shortened. Thank you.